BMI. BMI means body mass index. It is a value derived from the mass, that is weight and height of a person. The BMI is defined as the body mass divided by the square of the body height and is expressed in units of kg per meter square. Resulting from mass in kilograms and height in meters. The BMI may be determined using a table or a chart which displays BMI as a function of mass and height using contour lines or colors for different BMI categories, and which may be used are the units of measurement. BMI is a convenient rule of thumb used to broadly categorize a person as underweight, normal weight, overweight, or obese based on tissue mass, that is, muscle, fat, and bone, and height. Major adult BMI classifications are underweight, that is under 18.5 kg per meter square, normal weight, that is 18.5 to 24.9, overweight 25 to 29.9, and obese 30 or more. When used to predict an individual's health rather than as a statistical measurement for groups, the BMI has limitations that can make it less useful than some of the alternatives, especially when applied to individuals with abdominal obesity, short stature, or unusually high muscle mass. BMIs under 20 and over 25 have been associated with high all-cause mortality. A common use of the BMI is to assess how far an individual's body weight departs from what is normal for a person's height. The weight, excess, or deficiency may in part be accounted for by body fat, although other factors such as muscularity also affects BMI significantly. The WHO regards an adult BMI of less than 18.5 as underweight and possibly indicative of malnutrition and eating disorder or other health problems, while a BMI of 25 or more is considered overweight and 30 or more is considered obese. BMI is used differently for people aged 2 to 20. It is calculated in the same way as for adults, but then compared to typical values for other children or youth of the same age. Instead of comparison against fixed thresholds or underweight and overweight, the BMI is compared against the percentiles for children of the same sex and age. A BMI that is less than the 5th percentile is considered underweight, and about the 95th percentile is considered obese. Children with a BMI between the 85th and 95th percentile are considered to be overweight. The BMI is generally used as a means of correlation between groups related by general mass and can serve as a vague means of estimating adiposity. The duality of the BMI is that while it is easy to use as a general calculation, it is limited as to how accurate and pertinent the data obtained from it can be. Generally, the index is suitable for recognizing trends with sedentary or overweight individuals because there is a smaller margin of error. The BMI has been used by the WHO as the standard for recording obesity statistics since the early 1980s. Overweight and obese individuals are at an increased risk for coronary artery disease, type 2 diabetes, gallbladder disease, hypertension, osteoarthritis, sleep apnea, stroke, Infertility, at least 10 cancers including endometrial, breast and colon cancer. So, from BMI, we can know about obesity, that is stollia, and emaciation, that is karsha. So, what is obesity? What is obesity? Obesity is accumulation of excess fat in the body, which may lead to negative effects on health, reduce life expectancy, and or increase health problems. A major proportion of diabetes, ischemic heart disease, hypertension, ischemic stroke, osteoarthritis, and cancer burden may be attributed to overweight and obesity. In Ayurveda, atistolia is described as excessive accumulation of meda, that is fat or adipose tissue, and mamsa, that is flesh or muscle tissue, leading to flabbiness of hips, abdomen, and breast. It is considered as one of the Santarpona Vikara, that is disease due to consumption of excessive calories in Ayurveda. Medhodushtihi, disorders of fat metabolism, may be one of the risk factors for ischemic heart diseases. What are the causes for obesity? Increased intake of energy-dense food that are high in fat, carbohydrate, overeating and irregular food habits, lack of physical activities due to sedentary lifestyle, genetics, endocrine disorders, medical reasons, or psychiatric illness, and daytime sleeping. The BMI is generally used as a means of correlation between groups related by general mass and can serve as a vague means of estimating adiposity. The duality of the BMI is that while it is easy to use as a general calculation, it is limited as to how accurate and pertinent the data obtained from it can be. Generally, the index is suitable for recognizing trends with sedentary or overweight individuals because there is a smaller margin of error. The BMI has been used by the WHO as the standard for recording obesity statistics since the early 1980s. Overweight and obese individuals are at an increased risk for coronary artery disease, type 2 diabetes, gallbladder disease, hypertension, osteoarthritis, sleep apnea, stroke, infertility, at least 10 cancers including endometrial, breast and colon cancer. Now let us talk about karsha. Karsha is nutritional disorder described in Ayurveda Samhita and it is possible related to undernutrition. 35% of all death among children under 5 and 25% of total global disability adjusted life years lost among less than 5 children. According to Acharya Charak, a T-Karsha person are described under 8 people persons along with over obese, that is Ati-stool person. An over lean person has suksha speak udara griva, that is dried up buttock, abdomen, neck. They have prominent vascular networks. They have remnants of skin and bone and their joints are thick. According to Acharya Kashyap, described Vyadhi Samvaja Pakah and it is similar to malnutrition. Baloshodha and Shirhaja Paka are nutritional deficiency disorder mentioned by Acharya Vagbhat and Acharya Kashyap respectively. Similarly, Parigarbhikaha and Garbhaja Paka are caused by children on feeding breast milk of pregnant mother which has alpa poshak angshaha, that is poor nutrients. Shukshaha Revativan Graha, demons affecting the child, represents infection spectrum of diseases resulting Sarvangashayah, that is emaciation, and children becomes emaciated even to consumption of food of many kinds. All the diseases described in Ayurveda text is related to each other and possible to correlate to malnutrition like protein energy malnutrition, that is PEM. Dosha like alpakshanah and vishambashanah, vihara dosha like Atishrama and Mansik Bhavaha like Shok, Bhaya, Krodha are the main etiological factors for Karsha. Karsha is including whole of disease which are undertaken malnutrition. Nowadays, malnutrition is classified according to weight, BMI, etc. Karsha can be Swatantra Vyadhi and it is also can be a symptom or complication of other diseases. The Samprapti of Karsha is as followed. There is Nidan Sevan, that is Vata Vardaka Ahar Vihar. Then, because of this, there is vitiation of Vat, which leads to Agni Dushti, which leads to formation of Am. Due to Agni Dushti, there is Dhatu Shaya. And Dhatu Shaya and formation of Am leads to inadequate Rasa Dhatu and improper absorption due to formation of Sama Ahar. After this, there is Shoshita Rasa Dhatu, that is, it is failed to nourish tissue due to insufficiency. After this, undernourished Rasa Dhatu, Sukshaha, circulate in the body. Therefore, all the dhatus or tissues not get nourishment due to the Alpa Sukshaha Rasa Dhatu, which leads to Karsha. Its management is done by Santarpana Bruhana. WHO has described malnutrition as a global problem having adverse effect on the survival, health, performance and progress of population group. The effects are of the highest order in developing countries. Care of nutritional need is required at 3 stages: nutrition during pregnancy, nutrition in infancy, and nutrition in childhood. Fetal nutrition is totally dependent on maternal nutrition. The most significant in preventive measures for the disease is nutrition education, which including good antenatal care, encouragement to the mothers to breastfeed the infant, complementary feeding supplements should be combination of cereals, protein, rich foods and fruits.